So we finished talking about the kind of three major blood vessels that are found in the body. Arteries, which are the blood vessels that carry typically oxygenated blood away from the heart. Veins, which are going to typically carry deoxygenated blood back to the heart. And then in between them are our capillaries, where we perform exchange of nutrients and waste. What we're going to do now is talk about the different types of arteries, capillaries, and veins that we have. Starting with arteries, and the three major types of those include elastic arteries, which are the largest, and then muscular, which are obviously very muscular, but those are medium sized. And then the smallest are our arterioles. Your textbook actually classifies them as one of the major types of blood vessels in the body, but to me, it makes sense to say that there's three majors, because arterioles are a type of artery. So we have a bunch of them though. So that's why the textbook throws them in as their own category. All right. Arteries previously mentioned, efferent vessels carrying blood away from the heart. Structurally, walls of an artery will have three layers of a typical blood vessel, just like we talked about the other day at the end of the class. But there's a very thick muscular to elastic tunica media. So there's a lot of muscle, especially in the smallest ones, the arterioles. Okay. Due to their plentiful elastic fibers, they have, normally anyway, high compliance, which means that their walls stretch easily or expand without tearing in response to a small increase in pressure. Okay. That is a fantastic thing to have in a normal healthy artery. Unfortunately, various conditions can decrease this elasticity, and therefore it basically hardens them and they're less likely to stretch. That's called arteriosclerosis, and it's a degenerative blood vessel disorder. Let's talk about the arteries. So the three types include elastic arteries, which again, these are the largest, greater than 3/4 of an inch, so pretty darn close, in size. If you think like a garden hose, I don't know what the dimensions of a garden hose are, but pretty good sized. These are always going to be close in proximity to the heart. They're called elastic arteries because they have a lot of elasticity to them. Okay, they've got a lot of elastic fibers in them, which enables them to stretch without injury to accommodate the surge of blood that's forced into them when our heart contracts. But then, just like a rubber band, they recoil, they snap back. And once again, it's because they have a lot of elastic tissue in them, and actually it's more than what you see for the muscle that's in them. Okay, and that's important because then when the heart relaxes, the walls of these elastic arteries helps to force the blood forward, and that is very important. That also helps with smoothing the jerky discharge of blood from the heart, helps maintain your blood pressure, and causes back pressure to cause the semilunar valves, the aortic valve, and the pulmonary valves that we learned about last week to close. Okay. Due to these elastic fibers, as they stretch when blood is ejected from the heart, they momentarily can store mechanical energy, allowing them to function as a pressure reservoir. The elastic fibers then recoil and convert the stored energy into kinetic energy as the blood is pushed forward. So they kind of slingshot that blood forward because of this energy that develops when they're stretched. Examples of elastic arteries include the aorta, which we've talked about previously, the brachiocephalic up there in the upper chest, the neck, we have the two common carotids, the subclavians up there in the upper chest, vertebral arteries running up through the neck as well, and then the pulmonaries, which deliver the blood to the lungs, which we talked about them being the only arteries in the body that carry deoxygenated blood, and then the common iliacs, which are down there to feed your legs. We'll get in and see those here in just a little bit. Muscular arteries, medium-sized vessels, less than 3/4 of an inch, branch to distribute blood to specific regions of the body. These vessels have up to 40 layers of smooth muscle, constituting about 3/4 of its wall's thickness, and a lot less elastic tissue than what you saw for the elastic arteries. These are going to act to distribute blood flow to parts of the body that need it by performing vasodilation, which is where the lumen widens, and vasoconstriction, where it narrows. And we talked about that the other day. Their job is to help propel blood onward during ventricular diastole, which is when the ventricles are relaxed. They contract when stimulated by the sympathetic nervous system. They also help with stopping blood loss when we're bleeding. They help that can help raise your blood pressure and shunt blood flow from specific organs. Most of the arteries that we have names attached to them that we'll look at this lecture are in this category. And then your smallest arteries are the arterioles, which have a tunica media that's much thicker in proportion to the lumen than that of the larger arteries, allowing to function as what we call resistance vessels. That's kind of their nickname. And that relates to the ability of them to perform high degrees of constriction dilation. Their job, therefore, is to regulate blood flow into capillary beds and are important regulators of blood pressure. And it's because of the constriction dilation that they can perform. At the terminal end of an arteriole, you have what's called a metarteriole, which tapers towards its junction with the capillary. Most of the tissues of our body receive blood from more than one artery, which is important because if you've got blockage in one, there's still hopefully going to be blood flowing to that various tissue or organ. Okay. The union of branches of two or more arteries supplying the same body region is called an anastomosis. And the plural form of that is just where you substitute the I for an E. Okay. These provide alternate routes for blood to reach a tissue and organ. And we actually talked a little bit about those. I mentioned them briefly when we talked about the coronary circulation in our last lecture, when we talked about feeding the heart. We also will see anastomosis. There's actually quite a few more with regards to veins and venules in our venous circulation. All right, so those are your arteries. Let's talk now about capillaries. All right, capillaries allow for the transfer of nutrients and other vital substances between our blood and our cells. Okay, typically we describe capillaries as like what we call a capillary bed, and that's because you're not just going to find an individual capillary, but instead a whole bunch of them. Okay, the term capillary actually means hair-like. We find them connecting the arterial and the venous side, so in between the arteries and the veins. They have extremely thin walls, and we learned about that the other day, which aids in diffusion and exchange. They only have that endothelium and then a basement membrane surrounding it. Okay, capillaries comprise most of the 50,000 miles of vessels in our body. That's insane how much blood vessels that we have in our body. Okay, and most of that comes from capillaries. Diameter of a capillary's lumen is just larger than one red blood cell, allowing for ready gas exchange to occur. We can see that in our picture down here at the bottom with our, couple capillary or a couple red blood cells, and the blood vessel that's surrounding it is a capillary, which is just barely wider than that red blood cell. Okay, the more active metabolically a tissue is, the more capillaries it's going to have. So your metabolically active cells, like up in your brain, your heart, and kidneys, are going to have a lot. Those that are pretty inactive metabolically include like your bones, tendons, and joints, have very few. And then structures that we've recently talked about, like the lens and the cornea, have no capillaries, and we describe them as being avascular. Associated with capillaries are what we call precapillary sphincters, which are rings of smooth muscle that regulate the blood flow through the capillary. And we find them at that junction between the metarteriole and the capillary. And 3 types of capillaries exist in the human body. The first we have listed here is the most prominent type, and I would highlight this sentence here. And most capillaries are this form. We call them continuous because their endothelial cells of the tunica intima are held together via tight junctions, which then allows the capillary to form an uninterrupted tube. So think of these like the pipes that are in your house that hopefully aren't leaking and allowing water to flow in and out. Okay, what they will have though, and if I zoom in really far here, the little tiny crevices where the two cells or where two cells would meet, we call these intercellular clefts. Okay, these are so small that they are only going to allow very small things like molecules of glucose to pass through, but not obviously your big stuff. Okay, locations where you're going to find them include places like your brain, your lungs, as well as within skeletal muscle. Okay, progressively getting leakier. Our next type are called fenestrated, which have continuous walls between the endothelial cells, but the cells themselves have tiny little holes, not holes, sorry. Okay, holes or pores, I combine those two words. Holes or pores also go by the term fenestrations, which is where the term fenestrated capillaries come from, which increases their permeability, which means that more stuff can pass through them. And therefore, we find these in areas where there's a high transfer rate of substances necessary into or out of a capillary. And that includes places like your kidneys, which is where we filter our blood and we make urine. So we're constantly moving stuff out of the blood into the kidneys. And then in the villi of the small intestine, we haven't talked about that yet, nor have we talked about the kidneys, but the villi of the small intestine is where we do most of the absorbing of the stuff that we've ingested. So like when we pull glucose into the body after we've eaten it, after we drink water and we pull that into the body, most of that gets pulled into the blood through fenestrated capillaries in our small intestine. And then our absolute leakiest of the capillaries are called sinusoids or discontinuous capillaries, which have irregular blood-filled spaces. And we only find them in kind of three special places: the liver, our bone marrow, and our spleen. Okay. They look like Swiss cheese, and that's because they have these huge intercellular clefts or sinuses, which are so big that allow large molecules in some cells to actually pass in and out of the blood vessel. Okay. We find them in the liver because that's where we make our plasma proteins. Those plasma proteins we talked about the other day, like fibrinogen and albumins. Okay, those are made in the liver cells, and then they are able to get into the bloodstream in this manner. Okay, the bone marrow is where we make our blood cells, and that's why we have these here. The blood cells actually can travel into the blood via these guys. And then in our spleen, this is where we can actually remove blood cells. Same thing, we do that in the liver as well. Like as our red blood cells and our white blood cells kind of start to break down, we can remove them from the circulation that way. As far as the images go, I don't actually care about you identifying like the parts of them, but I do definitely want you to make sure you can identify that this is a sinusoid, that this is a fenestrated, and that this is a continuous capillary. Because you might see, one or two of those pictures on the exam, and I might ask you, what type of capillary is it? All right, and then our last major category of blood vessels are the veins. And we'll start by talking about the smallest, and then we'll working from there. So as previously mentioned, veins are the afferent vessels that deliver blood back to the heart. Several types and features associated with veins exist. Venules, once again, I just mentioned, are the smallest veins, and that's another category that your textbook actually kind of classifies as one of the 5 major types, kind of like they do with arterioles, but to me, there's 3. Okay. There's 2 types of venules that exist: post-capillary venules, and we call them that because they are the blood vessels that receive blood from the capillaries. Post, as you guys hopefully know, means after, so these are directly after the blood is flown through the capillaries. Okay, these are the smallest venules, measuring 10 to 50 microns in diameter, so they're very small, microscopic in size. They have loosely organized intercellular junctions and thus are very porous. Okay, which allows them to also perform significant amounts of nutrients or exchange of nutrients and wastes, as well as white blood cell immigration, which is where white blood cells actually can leave the bloodstream and travel into tissues to go fix things. And the other type of venules are muscular venules, which are larger in size, ranging in size from 50 to 200 microns. So they're still very small. They are called muscular venules because they have a thicker wall made up of a significant amount of muscle. The walls also will contain all three layers, but are still porous enough to allow white blood cells to pass through them. But the thin walls of both these two venules allows them to easily expand and serve as excellent reservoirs for blood accumulation. In other words, they can accommodate a lot of blood. And we kind of talked about that the other day. If I go back to that first page, remember, all of our veins are more wide open than what you see for arteries and capillaries, which allows them to hold more blood than what we see elsewhere. While veins do show some structural changes as they increase in size from small to medium to large, the structural changes are not as distinct as what we see in the arteries. That's why we don't have the three categories like I did for arteries. In general, veins have very thin walls relative to their total diameter, and they can range in size from 0.5 millimeter in our smallest veins to 3 centimeters in our largest veins, which 3 centimeters is like actually over an inch. And that would be like your vena cavas that we talked about the other day. Many veins, especially those in our limbs, contain valves, which we mentioned the other day, which prevents gravity from pulling the blood back towards our feet, or if like your arms are at your sides, down towards your fingers. They are formed from folds of the tunica interna. Weak or damaged venous valves can cause veins to become dilated and twisted in appearance. We call these varicose veins or varicosities, and I'm sure you've heard of and seen people with those. Occurs in veins of almost any body part, but it's most common in the supraveins of our lower limbs, the anal canal and the esophagus. Okay. Looking at the example here, we've got a picture of the leg of an individual where you can see those varicose veins through the surface of the skin. Over here on the right, or on the right side of what we would want is something like this. But in the case of an individual where a varicose vein is bulged and the valve is not completely closed like it should be. A special type of vein I want to talk about is a vascular sinus or venous sinus. Has a very thin endothelial wall with no muscle to alter its diameter. In a vascular or venous sinus, the surrounding dense connective tissue replaces its media and the tunica externa, providing support. Okay, an example is that coronary sinus that we talked about in our last lecture on the back side of our heart, which along with those two vena cavas that I just mentioned, help deliver blood back to your right atrium. You also have up in your brain and skull area, the dural venous sinuses that carry deoxygenated blood from our brain back towards the heart. We've actually mentioned those before back when we talked about the meninges because they're kind of intertwined with those. What we actually find is that veins are much more numerous than arteries, and there's a couple reasons why. We find them a lot of times in pairs, accompanying medium to small size muscular arteries. So where you might have one artery, you might have two veins. And these double sets of veins escort the arteries and connect with one another via venous channels called anastomotic veins. There's that kind of same word that we just talked about a couple slides ago, anastomoses. The subcutaneous layer deep to the skin is another source of veins. We call these superficial veins. They course through the subcutaneous layer unaccompanied by parallel arteries. Along their course, the superficial veins form small connections or anastomoses with the deep veins that travel between the skeletal muscles, allows them to have a connection between superficial and deep veins. Okay? And in some people, these superficial veins can be seen as blue colored tubes passing under the skin. I think like, especially if you're fair complected, you're going to be able to see these like on the back of your wrist or like in your, other areas of the body, back of your hand, I should say, not the back of your wrist. While the venous blood is a deep dark red, the veins do appear blue because their walls and the tissues of the skin absorbs the red light wavelengths, allowing blue light to pass through the surface to our eyes where we see them as blue. And that's a misconception I mentioned the other day. Blood is never blue colored, despite the fact, they look like they might be blue. Your veins aren't either. It's just that they are reflecting the blue light. Looking here, we've got a couple cool pictures. This is a transverse section looking down into a vein, and you can see the valves. Here's the longitudinal section where you can kind of see how the valves are built. But nothing picture-wise on this page would be on the exam. All right, and then our last slide here before we start to perform the identification of the arteries and veins want to talk about what we call circulatory routes, which we've actually kind of talked about these before back in our last lecture, but we have some other stuff to discuss as well. All right, arteries, capillaries, and veins are organized into circulatory routes that deliver blood throughout the body. The two major circulatory routes are the systemic and the pulmonary circulatory or circulation routes. Okay. The systemic is what allows blood to flow from our left ventricle into the aorta and then through the blood vessels to all parts of the body except the lungs, and then back to the right atrium. Whereas the pulmonary route conducts venous blood from the right ventricle to the lungs, and that involves those pulmonary arteries that carry the deoxygenated blood. And then we perform gas exchange inside the lungs where oxygen is pulled into the blood, CO2 is removed from the blood, and then we return that oxygenated blood back to the right, to the left atrium to then be pumped out into the systemic circulation. We talked about all that before, but you can see here on the bottom of the page, we've got an illustration showing those two different circulations or routes. Here in blue shaded is our pulmonary with the right side of the heart pumping the deoxygenated, and that's why it's colored blue, blood to the lungs. We then bring that blood back. Now notice everything's colored red to the left side. Then we pump everything out the left ventricle to be fed from the top of our head to the bottom of our feet. And as we can see, it begins with the aorta, colored red, and then eventually that blood comes back to the right atrium. Now, the simplest and most common route of blood flow is from our heart into arteries, then to capillaries, then to veins, and then the heart. However, variations in this sequence can occur. We've talked about one of these examples before, but a portal system is going to allow blood to flow through two consecutive capillary networks before returning to the heart. We talked about it back when we talked about the hypophyseal portal system. That's up in our brain. Anybody remember what that connected? Which part of the pituitary? Anterior and the hypothalamus. Okay. And remember, that's what allowed the hormones from the hypothalamus to be carried directly to the anterior pituitary before going anywhere else. What we'll see actually, and this will be our last coloring slide, is the hepatic portal system, which we can actually see right here. As we can see, most of the time we have basically parallel routes where blood flows from an artery into an organ and then from there into a vein to be delivered back to the heart. And like the kidneys are completely separate from the skin, from our skeletal muscles. But in the case of right here, we see blood's flowing into a capillary network or capillary bed in our intestines, and then a portal vein connects it to another capillary network, and that capillary network is in the liver. And what the importance of this is, once again, we do most of the absorbing of things that we ingest in our intestines. Okay, so in other words, like we're picking up glucose and amino acids from our intestinal tract here, and then we get to deliver them directly to the liver first, and we don't have to go to the heart and then back out to the liver. It's a direct connection, and this enables that delivery of the nutrients to go direct to the liver, because that's where we basically metabolize and we process like our our proteins and our fats and whatnot. Okay. On the right here we show what's called an arteriovenous anastomose, a thoroughfare channel or a shunt. All those things mean the same thing. This occurs when blood flows from an artery directly into a vein, and that's because the precapillary sphincters, not post, the precapillary sphincters are contracted, and thus the capillaries are cut off, and so the blood never flows into them. And so we skip from the arterial side into the venual side. We only have this occurring in places like our fingers, our toes, and our ears. And this is what we do when we get really cold, so that we reduce heat loss and can keep that blood deeper in our body, so that we don't continue to see body temperature dropping. As far as the images on this page, you don't need to worry about them. We're going to have plenty of other images to worry about, which starts right now. So what we're going to do is go through and identify the major arteries of the body. Then we'll do the same thing for the veins. There are no real like true ways to identify the capillaries, so we won't have to worry about that. I don't know why that's showing like that, so let me reopen it. Okay, so what I've done here is I'm going to start with the aorta, and that's a blood vessel we've talked about before. And we're going to kind of identify its major branches. If it will focus, that would help tremendously. There we go. As we saw in our last lecture, the aorta has kind of some different distinctive parts. And so you can kind of see it listed a couple different times here, like a figure A or letter A, aortic arch, then down about 2/3 of the way, you see A1, that's the thoracic aorta as it travels through the thoracic cavity. Once it travels past the diaphragm into the abdominal cavity, we would call it the abdominal aorta, and it's labeled A2. So we kind of talked about this the other day. And then as you can see, there's blood vessels kind of periodically breaking off of there to feed various structures in the body. And I list what structures are fed by each of those. For example, the brachiocephalic feeds the head and the upper extremity. I promise you there's not going to be any questions directly related to like what does the coronary artery feed or anything like that. Basically, the majority of this segment of the test will just be identifying these pictures. And so, there's 20 questions over this packet, probably around 15 of them will just be these pictures, and you'll have to identify them. And what you'll have to do is basically just, put the blood vessel where the arrow is pointing, because I'll more than likely put the arrows in for you to kind of help you. So with that said, let's begin coloring. Now, what I'll do is just kind of go through and color code, and then we'll go through and color and discuss. So I'm going to go pink for the aortic arch, yellow for the coronaries. Nice dark blood red here for the brachiocephalic. Nice aqua color green there for the common carotid. Blue for the subclavian. I put that peach. Sorry, let me grab a different color. Let's do black. All right, that's black for the thoracic aorta, sorry. Abdominal aorta, let's go orange. Dark green here for the renal. And then gray for the common iliac. And if you get lost, don't hesitate to stop me. Keep in mind, what we have here is a pretty far back in the chest and abdomen view, where we've essentially removed most of the organs. There's only a couple left. Like you can see the two kidneys down at the bottom. That's because they're so far back on the back wall. Just kind of visualize, if you kind of imagine where my fingernail is, that would be essentially where your heart is. And so we'll start up there where your heart would be located by coloring the arch of the aorta, or aortic arch, which comes up and then turns around and does a U-turn kind of over on the left side of our upper chest. Okay. The very first two branches coming off of it, and we've already kind of talked about these before, are the two coronary arteries. Like so. So nice yellow, you can see those pretty easily. All right, now since the aorta comes up and more over to the left side, we have a letter C artery here, which is kind of one of the rare instances from here on where we don't see it having a matching side on the other side of the chest. And by that I mean there's only one of these brachiocephalic arteries. It brings the blood to letters D and E, which, as you can see over here on the left side, D and E directly come off of the aorta. Okay. Well, D and E include letter D here, the common carotid arteries. The right common carotid comes off of that brachiocephalic, whereas the left common carotid comes directly off the aorta. Now, the word common is going to tell you that there's going to be a branch coming from it. Okay, there are what we call the internal and external carotids, which come off of that common carotid. We'll see those, but those are up in the head and feed like our face and brain. Okay. Letter E, also coming off of the brachiocephalic, is the subclavian artery, which is going to be a major feeder of our arms. On the left side of our chest, the subclavian comes directly off of the aorta, just like so. All right, now after performing its U-turn, we're going to go away from calling it the aortic arch, and instead it will be described as being the thoracic aorta, as long as it's up in our thoracic cavity. It actually pierces through the diaphragm, and we kind of lose sight of it until right down here by the letter L, where we will now transition to be calling it the abdominal aorta. It's now in the abdominal pelvic cavity. And it runs down, and as you can see, there's a lot of things coming off of it. A lot of those are going to feed our various digestive organs like the intestines and our stomach. Some of others like the kidneys. And since the kidneys are included, I thought I'd go ahead and color the blood vessels that feed those two organs. And those would be the renal arteries. Just like so. Now, also, the reason I color them, actually, despite their size, and your kidneys are very small, they receive a very significant amount of blood, especially when we're just like sitting around doing not much. And we'll find out a little bit more about that here in a couple of lectures. And then when the abdominal aorta comes to an end, it forks and forms the two common iliac arteries, which are going to feed our pelvis and our legs. And just like with the common carotid I mentioned, common iliac, and you can actually see it taking place here, comes to a fork and forms the external and internal iliacs. Sound good? Hopefully nothing too crazy here. If you get lost or if I get going too fast, please don't hesitate to holler at me to slow down. All right, as promised, I told you guys we'd identify the coronary arteries and coronary veins back in our last lecture. So here we are at that point. Okay, so we have that to discuss and do right now. Coloring everything out here. I'll start by coloring the right coronary artery yellow. Coming off of it, muscular branch, that will be colored pink. Right marginal branch, that's going to be baby blue. Posterior interventricular branch, that's going to be peach. Oh, that's weird. Just one way. What's going on with this document camera? There we go. All right, and then the left coronary artery, color it purple. Coming off of it, two major things include the anterior interventricular branch, which is being to be green. And I haven't done orange. Orange always works pretty well for the circumflex branch. Now, on the right side here where our picture is, we have an anterior view, okay, and there is no posterior view. So what we do is, for example, like the posterior interventricular branch, obviously is on the back side of the heart. And the illustration still does allow for you to identify with that blood vessel. See all these things that kind of look like zippers? Those are the blood vessels on the back side. So it's kind of showing you where that would be located without a posterior view, which is kind of handy. That way we don't have to color two different pictures. All right, the right coronary artery is letter A, comes directly off of that aorta. And then it actually goes around underneath of the right atrium through that coronary sulcus and twists around to the back side of the heart, like so. Okay, three major branches coming off of it. These three little connections on the front side of the heart are the muscular branches. Then you've got a right marginal branch, which is a little bit bigger and runs down more to the bottom side of the heart. But on the front side, feeding our right ventricle. The posterior interventricular branch runs on the back side in the posterior interventricular sulcus to the apex. Obviously, it would have like little branches coming off of it, but not gonna worry about that. Okay, then you have the left coronary artery, which is actually pretty short. This is all that there is for the left coronary artery. Okay, and we actually would not be able to see it without the pulmonary trunk being cut. So they've removed part of it, and it's because it runs posterior to that. Okay, the posterior interventricular, or excuse me, the left coronary artery comes to this point where it forks, and that forms this really big. And in fact, this is the biggest of all of our arteries of the heart. And we call this the anterior interventricular artery. It runs down through the anterior interventricular sulcus and feeds our left ventricle very nicely. They've shown over here, they've circled and zoomed in what can happen if that becomes occluded, forming or causing what we call myocardial infarction, a heart attack. And if this person was probably not in a hospital, they'd be in grave, grave danger, because that will be called a widowmaker heart attack. Other branch coming off of your left coronary artery is the circumflex branch, which I guess they call it that because it circles or kind of flexes around the back side of the heart, like so. Any questions? All right, moving on to talk about the blood vessels of our head. We are gonna do the right side of the body. So in other words, right side of our head, not right head, but right side of our head. Okay, that means we have a brachiocephaly to color first. If this was the left side, there wouldn't be that one because the subclavian and the right common carotid, remember, come directly off of the aorta. So color coding things out. We got the brachiocephalic first, and I will color that peach. The subclavian, I'm going to color kind of this lighter green color. Coming off of it. Purple, I will color the vertebral artery. The other branch coming off of the brachiocephalic, as we've already seen, in this case will be the right common carotid. And then, as I mentioned previously, there's two branches from it, an internal carotid. These internal carotid arteries are going to be very important because they feed our brain. The other is the external carotid, which stays more superficial, and this feeds more of our, like our face and muscles. Coming off of it includes a facial artery, which feeds our face. I'm gonna color that in gray. Feeding the back of our scalp and our occipital region. Should make sense, is the occipital artery, and then running up the side of our head. You can actually kind of feel your pulse in this one sometimes, is your temporal artery. I'll color black. All right, we don't have a great view of the entirety of the brachiocephalic, but we can see the tippy top of it, where it comes to its junction, okay, forming the subclavian, as well as the common carotid. Just color the subclavian for now. Coming off the subclavian, there's several. I'm only going to want you to identify letter D, which we call the vertebral artery, and that's because it runs up through our cervical vertebrae. And if it looks like it's segmented, that's because if you remember back when we talked about the cervical vertebrae, they have two extra little holes on the sides. Those what we call transverse foramina. And that's where this blood vessel is running up, and it's kind of protected by that. And now in the case of up here in the head, we see that kind of same zipper situation that we saw on the previous slide. Instead of being posterior, the zippers here tell us now that these are going to be more internal versus superficial. And so this blood vessel comes up, and it's actually going to be an important feeder of our brain, just like the internal carotid is. That we'll see here in just a second. Okay. All right, the other branch coming off of the brachiocephalic here on the right side is this very large common carotid, which is a very commonly utilized blood vessel when we take our pulse. If you do it in your neck, that's what you're using. It's your common carotid. Notice it comes to a fork, okay? Letter M is the internal carotid. And just like the vertebral artery, it runs interior and is going to start becoming more of a zipper in our illustration, thus telling you it's a deep blood vessel. Whereas letter O is the external carotid, and it stays superficial, and thus we don't see a zipper situation. The three vessels that come off of it that I want you to identify include letter R, the facial artery, which is this one that runs through our cheek, right along our jawline, and then up past our teeth, taking in our cheeks, and then it ends up there by our eye socket and nose. Sometimes if your heart's beating really hard, you can feel your pulse kind of like right there in that blood vessel. It's a little tricky to find sometimes, but it is findable. All right, then you have the occipital artery, which we call that the occipital artery because this is where it's at. Basically on the surface of our occipital bone and the back of our head. And then running up the side of our head is a very pretty big artery. Actually has two branches, a parietal branch and a frontal branch, like so. As you can see, there's a lot of other blood vessels that are, branching off and feeding different things in our head, but I'm going to keep it fairly simple for you guys. I know there's still quite a bit to know for these things, but there's definitely more that could be done. All right, let's talk about blood flow to the brain. Okay, we're going to see some of those blood vessels that we just talked about. Includes the internal carotid. Coming off of it includes the anterior cerebral and a middle cerebral, named because one feeds the front of our cerebrum, the other one feeds the middle parts of our cerebrum. Then you've got the vertebral arteries. So we just saw one of them on the previous page. I'll color those pink. Let's do black for the basilar. Cool gray for the posterior cerebral. Actually, you know what? That one won't. Let's do something that'll stand out really well. I'm gonna do blue for the posterior cerebral. That'll stand out a little bit better, and you'll see it a little bit easier. Okay, now what we have is basically a view of the brain upside down. So it's been removed from the head, plopped on a table upside down. Over on the right, we've got a view of the head and neck. This time it's on the left side. So I'm going to kind of color this one just for a couple of things, but this is the one that you're going to want to focus on. Okay. Coming off of the carotid, once again, or the common carotid, I should say, is this internal carotid, okay, which is letter A over here. If I zoom in, here we can see letter A on both sides of what we have labeled here as the hypophysis, which is a fancy term for your pituitary. There's the optic chiasm where the two optic nerves crisscross. Okay, it looks like there's not much to this blood vessel, but what you're really seeing in this image is just like, if I just like draw a line like right there, all you're seeing is like that much of it. Okay, because they've been cut off. Does that make sense? Okay. Now coming off of these two internal carotids, we have letter B, which is an anterior cerebral artery. Runs to the anterior side of our cerebrum, hence the name. Couldn't be any more straightforward as far as why it's named that. See it very nicely like so. The other branch coming off of the internal carotid is your middle cerebral, feeding the middle parts of our cerebrum. Now, if you notice here on the left side of the image that I'm coloring right now, we get a good view of it, and that's because we've cut part of the temporal lobe. I shouldn't say we, but the figure has part of the temporal lobe removed. So you can see what's in that little crevice deep to that temporal lobe there. Over on the right side of the image, we can only see a little bit of it kind of poking out right there and there. So. Okay. The other major feeders of our brain run up through the cervical vertebrae like so, and those are the vertebral arteries. And well, we have similar situation, just a little bit of the vertebral arteries shown in our picture. They're basically running up right in front of the medulla. And here's kind of a unique situation. Typically, blood vessels are like a tree in that they branch away from one another. But in this case, these two arteries are coming together. So they're converging and they're meeting and forming a blood vessel that runs right in front of our pons. We call the basilar artery. Several branches come off of this one, but the only one that I want you to worry about is the posterior cerebral. And we got a good view of it here on this left side, which I'm coloring right now, because if you hadn't noticed, a very significant portion of the cerebellum has been removed. Whereas over here on the right side of the image, we only see some of it. Because the entirety of the cerebellum is there. And I'm glad I chose that blue. It stands out real nice. All right, any questions here? All right, moving to one of our most complex images. We're going to look at blood vessels that come off the abdominal aorta to feed things like our liver, our stomach, spleen, the intestines, both small and large. And you can see there's a lot of things listed on this page. I've only got 3 things bolded for you. Along with the aorta, and this actually would be the abdominal aorta if we wanted to be specific, which I'll color orange. You're just gonna have to worry about identifying the celiac trunk, the superior mesenteric, and then the inferior mesenteric. Picture on the right is the one that you're going to have to identify possibly on your exam. Over on the left side is kind of a simplified illustration that I like to kind of demonstrate those 3 branches of celiac, the superior and inferior mesenterics, because it kind of shows you exactly what organs are fed. In most cases, it's not directly, but at least indirectly fed by those blood vessels. So I will color it, but this isn't the image because it's very anatomically incorrect. But there's your aorta. Over on the right side, the actual real image that you need to know. Here's the aorta, then we lose sight of it because it dips in behind the stomach. And then we don't see it again until it's almost completed its journey down the abdomen. Right there. Okay, coming off of it, way up here in the upper part of our abdomen, feed things like our gallbladder, our liver, the pancreas, the spleen, and the stomach is the celiac trunk, which to me, it looks very big here because it feeds all those different things on right and left sides of our abdomen. But if you don't watch out, you'll miss it. That's it. Okay. But you can see there's 3 things coming off of it. Letter C here. That is called the hepatic artery. Hepatic is a word that always refers to liver. You know, coming off of it, C1, C2, and going to the gallbladder's letter I. So that branch, very important. Okay. Then you got the letter J here. Letter J is the left gastric artery. Gastric is a term that always refers to stomach. That's what it's going to feed. And then letter K, what we call the splenic artery, because it feeds the spleen. Okay. All right, the superior mesenteric comes down and runs to the right side of our abdomen. Thus feeds things on the right side like our ascending colon, the cecum, parts of the small intestine. Okay. Over on the real image, you can see it's beginning up here. And then it dips in behind the stomach, just like the aorta did. And then that's what it does. Okay. And then coming off of it include letter M, the middle colic artery, which is right here. Letter N, what is called the right colic artery, and then letter O, which is the ileocolic artery that feeds ileum and colon. And then the inferior mesenteric runs down into the left side of our abdomen. It runs more inferiorly, which is where its name comes from, versus the superior mesenteric. And so it feeds like the descending colon and the rectum, whatnot. Here is it. Okay. 2 or 3, excuse me, branches come off of it. This R, which is the left colic artery. S is the sigmoid because it feeds the sigmoid colon. And then letter T, which hits the rectum. Therefore is why it's called the superior rectal. So could be a lot worse, obviously, but hopefully nothing too crazy for you there. All right, moving on to the arms, and then we'll get into the legs, and that should round us out on the arteries. Okay, we have a right arm, so we have a brachiocephalic. If this was a left arm, we just start with the subclavian coming off the aorta. Brachiocephalic, I will color orange. Subclavian, I will color this aqua color. Axillary, we'll go yellow. Purple for the brachial. Pink for the radial. Baby blue for the owner. Tan color for the palmar arches. And then in the fingers, how about nice dark red, or as it says, mahogany. All right, now here's where things kind of are tricky, and you'll see why. So letter A, here we've colored it several times now as the brachiocephalic, okay, which then comes to the junction where it forms the common carotid. That's labeled there at the top, and then letter B, which is important here, the subclavian. Okay, and the reason that things get a little bit weird here is because letter B then transitions to becoming letter C. And it's the same tube, it's the same vessel, but we change its name from the subclavian to now axillary as it travels through our armpits. And then as it moves down into our upper arm, that same blood vessel becomes known as the brachial artery. Same situation, same tube, same vessel, just different name. And this is actually very important. This is what we have our blood pressure read in most often. Okay. Now, obviously, these lines that you can see here to break them apart would not be in real life. So there's not like a real border. They would just you'd have to kind of imagine where that would be at. Okay. After crossing the elbow joint, the brachial artery forms 2 major branches. One runs down the radius, one runs down the ulna, and therefore those are known as the radial artery, which is what most doctors and nurses take a pulse in. And then the other running down the ulna is the ulnar artery. Pretty straightforward there. Now those both feed 2 little kind of loops. One's superficial and one's deep. I don't really care which one is which. Those are in our palms. We call the palmar arches. And then coming off of those, feeding our fingers, which also go by the term digits, or the digital, common palmar digitals. Sorry, that's kind of a brown and then red. I know those colors kind of are clashing. All right, into the legs. Now, unlike the arteries that we just saw in the arm, I only had an anterior view, whereas here I've got a posterior and an anterior view. So we've got two views. Basically, what we'll do is just kind of work from top down, okay? And we'll start with the very end of the aorta, the terminal abdominal aorta, as I have it listed here. Okay, which I'm going to color this cool gray color according to my old pencil. That's what it's called. Coming off of it is a common iliac on each side, fitting both of your legs, just like we've seen for like the common iliac or the common carotid. That comes to a fork in the road, one of which is the internal iliac. The one that we'll kind of focus more on is the external iliac. Just like in our arms, that actually will change names as it passes past our hip and into our thigh, where it will become known as the femoral artery. And then when it passes behind the knee, it becomes known as the popliteal artery, which I will color black. Did it freeze again? Yeah. Okay, let me reopen it. Did that fix it? Yeah. Okay. Frustrating, sorry. All right, popliteal is behind the knee, which as we know is the region known as popliteal region. And then we've got two branches coming off of it, one on the front side of the tibia, what we call the anterior tibial, and then the other being the posterior tibial, and then a couple of blood vessels coming off of those. So let's color anterior tibial pink. And then on the top of the foot is where you find the dorsalis pedis, which I will color baby blue. Posterior tibial, let's color it peach. And then two branches off of it, fibular, which one's down the fibula. I'll color that one dark red. And then let's see, I haven't used purple. That one's out. On the bottom of our feet are where we find the plantar arteries. All right, so this is kind of where it can get confusing. So just bear with me, and I'll try not to lose you. Starting here in our anterior view is the very terminal end of the aorta. So that's letter A, which then coming off of it are the two common iliacs. And we can't see any of this stuff in the posterior view. Here's the right common iliac, the left common iliac. They live well. I'll go ahead and color it. It was right there. Why not? Okay, and then you can see letters, what is that? G and C coming off of it. Letter C is the internal iliac. Not a whole lot to color there. And so that's all it is. It kind of looks like a little tail coming off of it. It then extends and forms D, but I don't even care about you knowing that. Letter G is the one that is more important in my opinion, at least anyway. And that's the first one we can actually see in the posterior view. That's the one that will, just like in our arms, change names as it travels past the hip into the upper leg, where it will now become known as the femoral artery. And then it's going to dip behind the knee, and we can actually see just a little bit of this happening right here, letter O. We get a much better view of it, obviously, in the backside view, the posterior view. That is the popliteal artery. Okay. And really bad knee injuries, like if somebody like dislocates their knee, that one can be basically pinched shut, and that can be a very bad thing because this is a major feeder of your lower leg. And you hear sometimes in sports, like an athlete almost had to have half their leg amputated. I can't remember which player it was a few years ago, had a really bad knee injury and they almost lost their lower leg. And it was because of this guy, but they were able to save him, and could have been really bad. All right, letter O, you can see, comes to a junction, and that forms letter P and letter U. Letter P is the anterior tibial. We can see it just beginning here in the posterior view, but it makes sense that we get a much better view of it. At least I hope it makes sense. In the anterior view, running down the front side of the tibia like so, to the junction there at the ankle where it will change names and run on top of the foot. You can actually feel your pulse right there where that little arrow is pointing, and we call that the dorsalis pedis artery. Okay, and it feeds skin and muscles on the top of your foot and to your toes, which, as you can see, letter S and letter R, T, and down there. I'm not going to get into those. The other branch coming off of the popliteal artery is here, letter U, which is the posterior tibial. Runs down the tibia on the back side, just like the anterior tibial, which was on the front side. And then there's two things coming off of it I want you to know. This one here that runs over towards the fibula, which is why it's called the fibular artery. And then on the bottom of the foot, forming this little loop here, is the plantar arteries. Same thing, one's down there into the toes. I don't really care too much about. They get out of number. They get out of letters. It looks like Z, and then they have to use numbers because there's so many. So I'm not going to worry about 27 things in one image. What's really cool, actually, if we go back up here, if you ever heard of like somebody having angioplasty surgery where they go in to their heart and they put a stent in, or they insert a balloon and they kind of basically blow things out a little bit to open up a artery that's blocked. They actually start right in there, and they do an incision right there in the groin with that external iliac, and then they just fish that line up through the common iliac up to the aorta and all the way back up to the heart. So it's kind of crazy how that all works. So, I mean, whoever thought, let's have heart surgery by starting in the groin, but it's pretty cool. So that's amazing. All right, any questions? All right, and with that said, we have knocked out all the arteries that I want you to know for the exam, which means we can start by going through the veins. Same way we did with the arteries, we're going to start close to the heart. Wonderful thing about the veins is a lot of times it's just named just like the artery is. So like we see common iliac, we see brachiocephalic. Okay, so you're not necessarily have to learn a whole bunch of different things. Obviously, there's some differences, which includes this internal jugular, which I will color red, brachiocephalic, which I will color yellow, superior vena cava, which we've seen before, receives blood from those vessels and dumps it into the right atrium. Then the common iliacs dump the blood into the inferior vena cava, which provides us with venous return from everything below the heart. Same situation, if you imagine where my fingernail is, that's where the heart would be located. Okay. Draining blood from our head and our neck is the very large internal jugular, which, if you hadn't guessed, there's also going to be an external jugular that's right there next to it that stays more superficial. This one, these I should say, because there's two of them, drain the blood that fed our brain. Okay. Those both lead to letter G, which unlike the brachiocephalic artery, there's two brachiocephalic veins, although as you can see, they're not like the same size. One's a little longer than the other. And those both lead to the superior vena cava. And then down on the other end, common iliacs should be right there by where the common iliac arteries that we just saw are. Those converge and drain the blood into this really big inferior vena cava. Which we saw in our last lecture. All right, so nothing too crazy, hopefully anyway. One thing, I'm actually gonna take a pause here. I was hoping we could get all this done in class today, but it's like I said, kind of a slog getting through it all, so it moves pretty slow. I think doing the coloring on your own, it shouldn't be too difficult. If you go into Canvas, right here under Unit 6, there's this tab here, Vessels Coloring, where I have just colored all the pages and then scanned them and put them in this document. So what you can do, and it shows it really nicely, scanned really well. But you can just hop on your computer or phone or whatever, and then just do the rest of the coloring on your own. I don't think we really need to be in person to do that. So you will be able to get the information that way. And then on Thursday, if you struggle with anything, just, we can talk about it in class. That way we can do the last couple of slides and then we'll just basically be done with the lecture. So on Thursday, we can start fresh with the lymphatic and immune, or the lymphatic lecture, sorry. Kind of forgot, I did include in my version here some actual cadaver pictures, so I want to show those off too. Here's a nice view of the upper chest where you can see here's the heart, there's that pulmonary trunk, here's the aortic arch, and then this gives you a really cool view of the brachiocephalic. Here's the left common carotid, whereas over here is the right common carotid coming off of the brachiocephalic. Here's a good view of that subclavian that's going to come up, and then it's going to do a U-turn. The right subclavian here we can see is coming off of the brachiocephalic, and then those feet are arms. Okay, onto the next page, we get a view of the abdomen. Here's the inferior vena cava that we just colored. Right here is the abdominal aorta, and you can see like the renal arteries feeding the kidneys. Here's a good view of the abdominal aorta and where it forks from the common iliacs. And then you can see the internal, the external. So that's pretty cool to see, but obviously not something I would worry about you knowing for the exam. I do want to jump to the very last slide, which is actually real quick. I don't have any good pictures for the arms to color for the veins. You'll notice that these are pictures from your textbook. And you can hopefully kind of appreciate why I like to color it, because when everything's the same color, blue or red for the arteries, it's really hard to tell what's what. And as I mentioned, we have so many veins, like there's 2 radials, 2 ulnars, especially in our arms, it's just hard to color because there's just so much. I'm not going to put these 2 pictures on the exam. It's just too hard. This is on the left, an anterior superficial view. This is the anterior deep view. So, I mean, you're talking about 2 frontal views to show a whole bunch of arteries. There's going to be veins. So I'm not going to put those on the exam, but I wanted to include them nonetheless. Now I can jump to the last slide, which is going to discuss some stuff associated with babies. So let's do that now. and then that should round us out for the day. All right, the circulatory system or cardiovascular system, same thing of a fetus, is called fetal circulation. Exists only in the fetus, contains special structures that allow the developing fetus to exchange materials with its mother. So we're talking about a baby inside mama's tummy, inside the womb, okay? And we kind of have mentioned a little bit about some of this stuff already back when we talked about the heart the other day. This is different from postnatal or afterbirth circulation because our lungs, our kidneys, and GI organs, are like intestines and stomach, don't begin to function until birth. And that's because we don't need to breathe, we're not eating, we're not drinking, we're not, needing to get stuff in those ways because it's all coming in through mom, okay? Our oxygen, our nutrients are coming into our body from mom, and we're removing CO2 and other waste into our maternal blood, into mom's blood, okay? This exchange of material between fetal and maternal circulations occurs through what's called the placenta. This is going to form inside the mother's uterus and attaches to the baby's umbilicus or navel, or what we would commonly call our belly button, which is what forms. It's basically just a scar when that umbilical cord is cut, okay? And it's become the umbilical cord. That's the connection that runs into the baby's tummy. Here would be the baby's belly button area, the umbilicus, okay? Here's the cord, and then here's the placenta, which connects to the wall of the mom's uterus, okay? When a baby's born, okay, the first thing they do, once to make sure the baby's breathing and everything, they cut the cord, and then, then the baby starts breathing and, being able to nurse and all that wonderful stuff on their own for the first time, which is very amazing, really, really cool. Okay. Communication with mom's cardiovascular system occurs via small blood vessels emerging from the uterine wall. Umbilical cord contains blood vessels that branch into capillaries in the placenta. Waste from the fetus diffuse out of the capillaries into the spaces containing maternal blood in the placenta, and then into mom's uterine veins. Nutrients travel in the opposite direction. Okay. Blood is going to pass from the fetus to the placenta via two umbilical arteries, which branch from the internal iliac arteries that we just talked about, located within the umbilical cord. Okay, if we look here in our illustration on the left, here are the two umbilical arteries coming off of the internal iliac. They're coming and delivering the blood to the umbilical cord. Okay. At the placenta, the fetal blood picks up O2 and nutrients and eliminates CO2 and waste. Oxygenated blood returns from the placenta via a singular umbilical vein, which ascends to the liver and then divides into two branches. We should see that occurring right here. Okay. Now notice the color of this umbilical vein is red, which is telling you that it's got what in it? Oxygen, okay? And that's because this is coming from mom and her oxygenated blood, okay? Comes into the liver, sorry, and then we can see it forms two branches, okay? One branch joins the hepatic portal vein, enters the liver. The other branch, what we call the ductus venosus, drains into the inferior vena cava, okay? Here's one of those branches joining the hepatic portal vein, like so. The other right here, ductus venosus, special name, joins with the inferior vena cava, okay? Now, notice, actually, let's do that real quick. Notice what color we're going to see here is purple. Okay, we go from red to now purple, and that's because here this blood is now what we call mixed blood. It's mixed because it's joined deoxygenated blood and oxygenated blood. And if you think back to elementary school and you mix red paint and blue paint, it makes purple paint. Okay, so they use the color purple to denote the fact that there's mixed oxygenated, deoxygenated blood. Okay. So mixed blood in the inferior vena cava and deoxygenated blood in the superior vena cava pass into the right atrium. We see that taking place right here. Notice the superior vena cava is blue, whereas here the inferior vena cava is purple. Okay, those form mixed blood in the right atrium. Okay, instead of passing into the right ventricle, some of the blood will pass into the opening or through the opening known as the foramen ovale and go directly into the left atrium. That's one of those two lung bypasses I talked about in our last lecture. Okay. Now, not all that blood is able to go directly to the left atrium. Some of it does make its way into the right ventricle, which is then going to be pumped out into the pulmonary trunk. Okay. And then most of that blood is not going to go to the lungs, but instead will pass through the ductus arteriosus, which is this little tiny connection between the pulmonary trunk and the aorta. And we talked about that as being the second lung bypass that a fetal heart and blood vessels will have. Okay, so therefore it connects the pulmonary trunk to the aorta. This blood in the aorta is carried to all tissues. So this is systemic circulation in the fetus. When blood reaches the common iliac arteries, part of the blood flows into the internal iliacs, then into the umbilical arteries, and then back to the placenta for another exchange to occur. So we'll see that taking place right there. Now, over on the right side of the page is what we see here labeled as circulation at birth. When the umbilical cord is cut, notice there is no connection to a placenta. Okay. Think of it this way. Is there any reason to deliver blood to the belly button, or is there blood coming in through the belly button anymore? No. Okay. So some changes are going to have to occur, and that's just fine because now the lungs, the kidneys, the digestive organs are functioning, hopefully anyway. So the baby's breathing and it's, filtering its own blood and making its own pee. It's, ingesting breast milk or, formula, and thus is going to get its own nutrients and make its own waste and start pooping on its own as well. And that takes place pretty darn quick. Okay. Following changes occur. Okay, and these are 6 things that I definitely want you to make sure you know. The umbilical arteries, those blood vessels that brought blood into the belly button, no longer serve a purpose. So they get replaced and become basically connective tissue that serves no more purpose, but those become what's called the medial umbilical ligaments. Okay. The umbilical vein, which is the blood vessel that brought blood into the baby's body, no longer serves a purpose. It becomes what's called the ligamentum teres. It's just like these two medial umbilical ligaments, just connective tissue. Think of like a scar that has no more purpose. That ductus venosus, that branched off of the umbilical vein, no longer serves a purpose. It becomes the ligamentum venosum. Okay. Probably before any of that stuff's going to happen is the placenta is going to be expelled as afterbirth. Now, this is something that happens in all, animals that give birth, and some animals, actually, the mom will eat this. Like cows, it's pretty common for the mom to eat the afterbirth, or some cultures they use the afterbirth for different things. In America, most of the times it's just like tested on, and they draw blood and whatnot from it. There's a lot of benefit to studying the afterbirth, but in America, it's not very common for people to use their afterbirth to get nutrients, although there's a lot of science that says it's really good, but whatever. The foramen ovale, that hole in the heart, should close. Now, this doesn't happen immediately. It takes place about a year after birth. At least that's what it's supposed to. I've taught this for several years, and I've had students tell me that like they've had a sibling or they themselves found out later in life that that hole never permanently closed. That can be an issue. They might get more lightheaded because their blood is more mixed coming out of the aorta or coming into the aorta, and thus is not fully oxygenated. But some people survive just fine without it. And then also the other lung bypass closes off and becomes the ligamentum arteriosum that we previously talked about in our last section as well. Okay, any questions? As far as the 2 pictures go, don't worry about them. You don't have to like trace the flow of blood in and out of the baby and into mom and out of mom. Make sure you know like what the placenta is, what the umbilical cord is. Make sure you definitely know these 6 things here at the bottom that occur when the baby starts to get by on their own a little bit. Anyway. All right, we'll stop here for today. This is a perfect spot. We're done with the lecture, so we'll start with the lymphatic lecture on Thursday. It's a fairly short lecture, so we should be able to get done with it. We might even be able to start a new lecture. Just kind of see how that goes. So I'll set you guys free. Have a great rest of your day. I'll see you Thursday.
I will not be here Thursday.